Can DGL licorice raise your blood pressure with acid reflux? Have you ever wondered if deglycyrrhizinated licorice, often known as DGL, could affect your blood pressure while dealing with acid reflux? Let's break this down together. DGL is a special form of licorice that has most of the glycyrrhizic acid removed. This is important because glycyrrhizic acid is the part of regular licorice that can lead to higher blood pressure by interfering with hormones that manage fluid and salt balance in the body. Since DGL has significantly less glycyrrhizic acid, it is generally seen as a safer option for those concerned about blood pressure. However, it is essential to note that even with reduced levels, there could still be a slight risk of raising blood pressure if DGL is used excessively or for long periods. This is because trace amounts of glycyrrhizic acid might still be present, and individual reactions can vary. For those who have high blood pressure or heart-related conditions, it is wise to keep an eye on your blood pressure if you decide to use DGL supplements. When it comes to acid reflux or gastroesophageal reflux disease, DGL is often recommended because it may help soothe the stomach lining. It does this by encouraging mucus production and improving blood flow to the stomach lining, which can provide a protective barrier against stomach acid. Unlike some medications for acid reflux, DGL does not reduce stomach acid levels. Instead, it supports the stomach's natural defenses. If you are thinking about using DGL for acid reflux, here are some practical tips to keep in mind. First, always stick to the recommended doses and avoid going overboard to minimize any potential effects on blood pressure. Before starting DGL, it is a good idea to consult with a healthcare provider, especially if you have high blood pressure, heart disease, or are taking any medications for these conditions. Regularly checking your blood pressure during DGL use is also a smart move to catch any changes early on. While DGL may help with mucosal health, keep in mind that the evidence supporting its effectiveness in reducing acid reflux symptoms is limited. In summary, DGL licorice is less likely to raise blood pressure compared to regular licorice due to the removal of glycyrrhizic acid. However, caution is still recommended for those with blood pressure concerns. Its primary role in managing acid reflux is to protect the stomach lining rather than alter acid production, making it a natural option worth considering with proper medical guidance.